A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, thank you everybody for joining us today. It's lovely to see you, and I'm so pleased to be able to welcome Dr. Anthony Pontes back to talk to us. Thank you very much for coming back, Anthony. How are you doing?
Hi, Mary. It's good to see you again. We're making a real habit of this, huh? It's pleasant.
There's so much to talk about, isn't there? We've got so many different aspects of homeopathy to be covering, and I love to talk to you because you bring a different aspect about it. And of course, your training in South Africa covers so much more than we study in the Western homeopathic schools. And so you always bring so much to these podcasts. So thank you very much.
Great. Mary, I was thinking when I was preparing for this presentation that even generally patients, whether they're going to a homeopathy or they're going the medical route, they are also a lot more sophisticated today because they've got so much more access to information. So everything has moved to this higher level.
Yeah. And because, of course, homeopathy allows us to get to know ourselves much better, doesn't it? And it allows us to get to know our symptoms and what they really mean. And it allows us that curiosity to find out more about what Western medicine is actually showing us, and diagnostic tests and all of those different aspects. It's kind of giving everybody permission to ask more questions, isn't it?
I like the way you say that, permission. Yes, absolutely.
So let's have a look today at, perhaps you can help explain a little bit more. If people come to us and they've got diagnostic tests, perhaps they've had blood tests done, or you're seeing particular symptoms, do you ask your clients to have blood tests? Tell me a little bit more about using other facilities to help us as a homeopath.
Okay, I like that. Help as a homeopath. So these lab tests are going to be pushing my expertise further. It's going to be helping me to get that patient better quicker because I've got more information about the condition. And the conditions, depending on the condition, you might do a lab test. Sometimes it's like clear cut and and it's a self-limiting thing. So it really depends what the patient is coming there for. And then you can take that a step further to, okay, I've been treating this person for a long time and we've hit a wall, we've hit a blank. Okay, maybe we need to bring out a diagnostic test or 2 or 3 just to change things up, and maybe I've missed something. All right. Because the beauty of the homeopathic methodology is you're going on symptomatology. So from one perspective, you could say, hey, I've got all the information because the patient's giving it to me through the symptomatology. But if we go back to how homeopathy evolved, we go back to the proving. And the proving is where we get our symptomatology from. So it was the provings, and it was also the poisoning. So when we look at how homeopathy was brought about and how it developed, we look at provings, and the provings is where we get our symptomatology from. But also from the poisonings, that good experiment of cinchona causing that malarial fever, okay, and we get symptoms. But then also clinical observations. And, from the late 1800s up until now, the clinical observations have improved. And I'm using this file, so to speak, as where we do the diagnostic tests. Also, if you look at diagnostic tests, that field of medicine has improved or grown exponentially. So that's where I would put that in for homeopathic wise. right?
Yeah.
But, like you were saying, not all homeopaths are trained to use medical diagnostics. A lot of the legislation, sometimes you have to be a medical doctor. Those people obviously are. And I know this is not an exhaustive list, but I know the homeopaths that are trained in India, that are trained in South Africa and France, I think it is, they have medical training included there. So in absolutely no way would I say that, without diagnostic tests, your homeopathic treatment is inferior. By no means. Maybe in a way the opposite, because you have to be like super on par, because you have to be super aware of every single one of the symptoms to try and put it into your materia medica and to develop a good prescription. But if I can maybe go and talk a bit about how I get these blood tests in, or whatever the lab test is, and show you what I mean by it helping me a lot. All right. So I say I can get more accurate data, or maybe more specific data from the test, to maybe limit a infective process. So if I can give you an example quickly, the diagnostic test of a full blood count or a complete blood count that's used by nearly every single medical practitioner, and it gives us a quick overview of what's going down in the blood in respect to infections and your blood, your potential to have anemia, and you can say tiredness or weakness or blood clotting issues. So on that part is very effective. And if you've got someone, for example, let's look at someone who's got fatigue, all right? So you might rattle it around in your head. Yes, I think they might be anemic, okay? But is it anemia? Is it hypothyroid? Is it a viral aspect? So then by going in with this lab test, you can determine straight away, okay, it is anemia, okay? Or, and talking about that, that's the full blood count. If you pull in an iron profile as well, you can determine, okay, it's just anemia, or is it that the ferritin is also low, but means they don't have any iron? Or, the hemoglobin levels might be just on par, and it's not anemia, but by looking at that lab, you'd say it's anemia. But if you take a B12 test, yes, they've got low B12, so it's pernicious anemia. Give them some B12 and they recover quickly. Or if we take it to the more chronic case, someone who is suffering from anemia from a chronic perspective, and you want to track and see, you've given the homeopathic remedy and you want to track and see, are they improving? You can get objective markers. Yes, the iron has come up X%. We need to still go up 30%, but the treatment is working. Where from a symptomatology perspective, you ask the patient, they say, yes, I'm feeling a little bit better. That's like a bit of quicksand. You can fall into that quite quickly. So it just helps to push things along. And when you have a look at it like that, you can even, sharpen your homeopathic skills, because you're going to be saying things like, oh, okay, no, it's not their iron, but for some reason the oxygenation has dropped. Maybe you can then use some erythropoietin. It's a homeopathic remedy made from a hormone in the kidneys, okay, to stimulate that response. Or if it is an iron issue, you might use ferromet, which is, they fatigue, they've got this genuine anemia, you can see the signs, they might be pale, etc., etc. Or if it's not that, okay, it's an infection, then you're going to use ferrum phos. So it can help to stimulate which homeopathic remedy that you're going to use, and then the results will be, dare I say, to be a lot quicker, because you're so certain it's that. You're not going to be giving the remedy in 2-3 days, it hasn't worked, you say, okay, change over. It's really way.
And of course, so many people have tests and have ability to be able to order tests. And so do you often ask people to have tests before they come and see you, or do you organize tests for them? How does that work?
So it depends what the patient is suffering with. and I don't know if it's the same there where you are, Mary, but like tests are quite expensive. And as a homeopath, they don't, insurance doesn't always cover it. So, if you've got a lot of funds that you can throw towards tests, it is good, but most people, it's not like that. So I would say, okay, come in, we see what's wrong, we see what they're wanting to improve. I also use bioresonance testing, which is another step, and it's relatively cheap. Okay, so I can get in the ballpark and I can say, yes, it definitely is your thyroid. And if it is the thyroid, we're going to be saying we need specific testing for the thyroid.
Okay.
Now, here's the thing with those lab tests. And this is one of the reasons why thyroid is so misunderstood and misdiagnosed, and it's just a mess, because the medical fraternity is such that they will only order, when they're only taught to order, a TSH and a T4. Well, you categorically cannot say from that you've got low thyroid or your thyroid is imbalanced. Okay, and this is why so many people have got they're walking around with misdiagnosed conditions. They're not recovering. You need to order the T3, the T4, and especially today where there's, can I go as far as say 70 to 80% of thyroid disease is autoimmune. You have to order those antibodies. And the big stumbling block is insurance doesn't pay for those antibodies because it's linked back to the medical model, and they say you don't need that because the medical model can't treat that. So why do we even teach our people?
Why would they test it? That's really interesting. That's really very interesting to know. In the UK, it's expensive for people, and people don't generally have tests. If they do order them, like you say, they're very, very limited. I think in the US, they're more used to asking for tests. But you're absolutely right. If the Western medicine cannot treat certain things, then they're not going to test for it, because there's no point, because there has to be, a goal, doesn't there, for every test that
there has to be a goal. And I'm going to be almost, do I say smug, or maybe something to this effect, that if they can't prescribe a drug for it and earn money off it, they're not going to treat it.
No.
Okay. And we, as the party on the other end, basically suffer because of that.
Yes.
So this is where I would say homeopathy or holistic medicine or natural medicine is so amazing, because it brings in the aspect of the patient, which is not just purely scientific lab test, it's taking the aspects of how do they interact with their family or with their work colleagues, what is their sleep cycles like, these type of things. So if you can combine that with the lab tests or the science, the medical science, beautiful, you get a much better idea of what is going on with the patient, because, and this figure might not be 100% accurate, but if I look at it, 60 to 70% of the cases that I see, they've got physical symptoms, but the causation is emotional. So we can treat the physical symptom. Here's a typical example, and I can bring the lab test into this. Someone would come in and they've got a bladder infection, right? And you treat the bladder infection, maybe a cantharis or so, and it improves a little bit, but these bladder infections can sometimes hang around for a while. This is when it's good to test with the white blood cells and neutrophils to see if there's an infection. Okay, and then on the flip side of it is they can have the symptomatology of an infection, but you do the test and there's no infection there. That's when we're looking at the emotional aspect coming in. Okay, they pissed off, or some emotional effect has come in. But what often happens with the medical profession is, oh, here's your antibiotics for your bladder infection, when it's not from that. So this is a nice way to get around that, or to speed up the process for the patient. I think also that education is so lacking, or another way to put it is, people will look at what the medical doctor says as gospel almost. Right? And you'll see when I talk about cholesterol that this is a huge problem. So if the medical doctor says that, then that's what I've learned to believe as the truth. And this is also another reason why disease can take so long to recover from the disease, because they're going about it in a way that is not either sustainable or it's not building up their healing ability. Their body's not being able to throw off the disease. And it's just a chronic process from day to day. And as a homeopath, that's not what you look at. You're looking to invigorate that vital force to be able to throw off the disease process. Okay.
Yes.
And yes, maybe it would take some time because you're building up the energy. You're getting the mitochondria to get the ATP up, or however we see the process happening. But that's our ultimate goal.
And what I love about homeopathy is the fact that we are giving people back the responsibility of their own health. And I do find it difficult sometimes with normal Western medicine where people are just handing over their health to a profession. But they're never going to know as much about your health as you do. So, you are the best person to have responsibility for your own health. And just having that opportunity to make your own decisions just seems to make sense for me.
Yes. I suppose there's horses for courses, and there'll be that person that is too scared to take any responsibility on. And I don't know if you've had similar experiences like this. A lot of patients, they are so passionate about homeopathy or healing, and they've been the medical route and they haven't had success, or they've had limited success. And then they come to homeopathy and they're like a kid that has been starving, and there's just these sweets and this bread in front of them, and they're just eating it all up. And I find a good percentage of those people are so passionate, and they get into it, and they even turn out to start studying homeopathy.
Yes. It is so important to understand that homeopathy is a complex medicine, and it's not just about this remedy for this and this remedy for this. It is all about understanding the whole picture. So while we're on the picture of whole picture, talk to us about cholesterol, because this is a really big thing, because people come and they are almost being bullied, with, your cholesterol's too high, you have to do this, your cholesterol's too high, you have to do the other.
Yes.
What do you do with patients that come to you with high cholesterol?
Okay. Can I answer you that after I talk to you a little bit about what we call your redox potential? So when we're talking about lab tests, as I said, you don't just want to go out and order all these hundreds of lab tests, okay? So as much as I can, if I can look at the holistic part and see by some of the symptoms, the tendencies or the trends, okay? And one of those trends is what they call the redox potential. Now, that is how well your body is metabolizing the food that you're eating, whether it be the blood sugar or whether it be from fat, okay? So if you take the example of fire, right? I've got wood, I burn the wood and I get so much energy, and at the end you've got this ash and it's totally burnt out. That is a really good redox reaction, okay? Now, if I can get that into my body, I'm not going to be having conditions like cancer or chronic disease, right? Now, there is a blood test that you can do. It's called a bun creatine ratio. For that, it works around the kidneys and the liver. I don't often use that. I would go first for symptoms and get a general idea. Is this patient suffering with a low redox potential? And the symptoms that we look at are things like loss of libido, erectile dysfunction, inability to lubricate sexually, the quality of your hair nails. If that's poor, you've got a leaky gut, you've got low redox. Poor sleep, low redox. Okay. Here's one that has fascinated me. It's cataracts. I don't know if you can remember when you were small, Mary, when you were a child, cataract operation, no one was having those. Okay. Everybody and their dog now is having a cataract operation. And I assume if I've got cataracts and my vision is poor, it's going to be lovely. Okay, so I'm going to get my eyesight back. But what are the deeper effects of the cataract? And this is this low redox potential. This low redox reaction. So it's telling me that my body is not able to burn that food properly. So you're going to have toxins in the body. A good way to explain it was if I talk to you about blue light toxicity. It's poor memory. It's ringing in the ears. This is all symptoms of low redox potential. And if we can see this and start changing things and moving things around. And this has got to do so much today with our light intake. So when I talk about the light intake, I want to talk about vitamin D quickly. We'll get to cholesterol. It's like a pathway that you must go down so that you can understand it better. So if we talk about vitamin D, I'm not sure how familiar you are with it, but it's I say it's a test that is so important, but it's almost a paradox because almost everybody and their dog has got low vitamin D. And why is that today? Because we are inside right now. I'm in my office. You're in your office. Okay. Yes, there might be sunlight coming in through the window. And again, depending where you are and what your seasons are like, maybe you don't get a lot of light exposure. Maybe in winter, you're like inside all the time. Okay. Your vitamin D levels are going to go down. Now, vitamin D, yes. And then on top of that, we're sitting in front of our computers, we're sitting in front of our iPhones, we're on Facebook or social media or whatever it is, okay? All that blue light is being pumped into our eyes. And vitamin D test can be used as a proxy for blue light toxicity, telling me that my functioning of certain hormonal pathways is incorrect, leading to chronic disease. So what does that mean? When we look at vitamin D, or if we look at the blue light toxicity, or if we even just look at sunlight, they talk about vitamin D being the sunshine vitamin, all right? We look at our bodies as biological systems that are regulated by light, okay? What makes you wake up in the morning, Mary? You've got your cortisol response, which is stimulated by light, okay? If you lock yourself into a dark room and go to sleep, you're not going to wake up at 6 o'clock. Okay, it's a light that stimulates. It's a light coming into your eyes. So when you don't have that, you don't wake up, or you don't wake up fresh, or you wake up groggy. The other way of saying that is, if you have it at the wrong time, you're going to have problems. So now what are we doing late at night when it's dark outside, when our circadian cycle is supposed to be in dark? Should be slowing down. Okay, I'm getting ready to go to bed. Okay, well, we're not. We've got light, we've got artificial light that is pumping this blue light into our eyes, which is telling our body, hey, it's daylight, keep going. All right, that's going to cause your adrenal glands to get exhausted. So what it does is it kills your melatonin, upregulates your cortisol. People are having sleep issues. Can you remember what we spoke about with redox potential? Poor sleep, poor redox potential. So it's all leaning towards chronic disease. So I didn't need a lab test per se, but a whole lot of these symptoms is telling me that this patient is on a fast track to chronic disease. So anybody with a vitamin D level below 35, you need to investigate further. You need to change these lifestyle factors.
Okay.
But so you can do supplementation. Better than supplementation is getting out in the sun. Okay. And here's a beauty, huh? And I picked this up because of my work with autoimmune disease. Homeopathic vitamin D, okay, does not block the hormonal pathways, right? It stimulates them. So it's like me whispering in your ear, Mary, you need to go and jog. You need to go and jog. Well, you get up and you go and jog and you feel much better, as opposed to being whipped to go and jog. And the whipping is the supplementation, which also may block some of the hormonal pathways. So homeopathic vitamin D, beautiful. And you can combine it with your supplementation. And then the other beauty with the lab test is you have your vitamin D lab test. Now you make some changes either to the diet or to the lifestyle, and the person comes back in a month, 2 months, and you take the vitamin D again. Oh, yes, it's going up. Now you can start tracking. Okay, because it's a chronic disease, sometimes it takes a while for the symptoms to turn. Now, if you're just looking at symptomatology, you're not sure. Okay. So
let me just interrupt you a moment and ask, is vitamin D a normal test that people would have on their blood tests? Because I don't remember seeing that very often. Is it something that you have to ask for? Or is
it's not like the full blood count, which will just come. So you do have to ask for it. Okay. And I'm not sure. Yeah, from your medical practitioner, I think your insurance will pay for that.
Yeah.
Okay. But the medical practitioners don't really look at that. They don't have the insight into what it all does.
No,
right?
exactly.
Some of them are, yes, okay, we need to get your vitamin D up, especially maybe the functional medicine practitioners, they begin to that, right? Where we as homeopaths have got the beauty of the homeopathic vitamin D. I think that is like so potent.
Yeah, absolutely.
As I say that, I don't have medical literature to back that up. Okay. But just putting one and one together, I can see how that would work. It stimulates that vitamin D receptor that is lethargic and sluggish and has it's like the doorway to opening up so many hormonal pathways, which is great. Okay.
And of course, what you do have are lots of cases.
Yes.
And coming together, with other people that have used this can be so important. But obviously, with the low redox reading that you're talking about, that can indicate many different areas, and we would then go on symptoms, would we, to decide what it is they're needing.
So yes, now here's where I'm going to come in and talk to you about cholesterol. And let's first dispel a few cholesterol myths. So if I just take my upbringing on medical science, the thing that I hear all the time is, oh, your cholesterol, you must be careful, you're going to have a heart attack. People are petrified for that, okay? And this is the way that the medical profession has kind of been drumming it into us. We all know that. Even if you have children now, they grow up, you don't tell them that, but they hear it, and it just sits. And when you go to the medical practitioner, they take your cholesterol test, and then they'll tell you, sorry, you've got problems here, you must not eat fat, and they go about it like that. Now, here's the thing. Cholesterol is the base substance to which all hormones are made, specifically progesterone, cortisol. So when your cholesterol goes up, it's a sign from your body that it's trying to help you to quell the excess inflammation. Okay. Cholesterol is made in the liver, and what the medics do is they will prescribe you a statin drug to limit the cholesterol. So if we're going to limit cholesterol, we're going to limit your body's ability to quell inflammation, and inflammation is the gateway to chronic disease. But at least I can feel safe because I know I'm not going to get a heart attack. So that doesn't make sense, right? And we had time, we could go into how all this cholesterol, I call it the cholesterol myth, the medics call it the cholesterol theory. And that is the problem. It's a theory or why the public is so petrified of high cholesterol. Just a quick little thing, when they were bringing out Lipitor, let's say the levels, the reference range levels for cholesterol were over here. A week or two, or a month before they brought out the Lipitor, they dropped the levels, which would mean more people would need cholesterol-lowering drugs. So things aren't making sense there, but they've got most of the people in fear for that.
Yes.
Now, also, the way they're testing the cholesterol from the 1960s, I don't know if it's like that in the UK, but here you can go to a pharmacy and you can get your HDL and your LDL and based on your total cholesterol, and then based on that, they'll tell you, oh, yes, go and see your medical practitioner, it's too high. Those tests are archaic. They actually don't mean much, okay? But when the patient sees it, it's like, oh my God, what am I going to do? Even I struggle to get them off their medication because they're scared of a heart attack, right? So what I have to do is say, okay, we're going to do some testing now. We're going to do it in a month's time or 2 months' time after you are on certain of the remedies, so that they can see to protect myself and to protect them. And then with the education, they start to trust you more.
Yes.
Right? Now, if we look at that with the cholesterol, I want to give you one more example, Mary. Let's say I take a drive with you and we pass this one road and you see there's a car accident there and there's an ambulance there, and we drive on the next corner, there's another car accident and an ambulance, and we drive on and there's another one. Then you turn to me and you say, oh, I tell you, these ambulances, they're really pesky. They're causing all these accidents. Okay? So the ambulance is like the cholesterol.
Yeah.
It's not the cholesterol that is causing the accident. The cholesterol is there because of the accident. The ambulance is there because of the accident. Okay, it's trying to reduce the inflammation, help with the cortisol and the progesterone. Okay, so that is a big thing to look at. Also, when we look at the lipids, I said to you that the testing that they're doing is so inferior. You get now what they called advanced lipid profiles or advanced lipid testing, where they do nuclear magnetic resonance testing. You can go on that, but too many people are prescribed drugs based on the old HDL, LDL reference ranges.
Okay.
That is, you're actually shooting yourself in the foot there.
Yeah.
But like I said, it's a big problem because everybody's leaning towards the medical profession. Even if you look at the medical legal things, they can come back, especially in the US, they can come back and they can sue you or whatever. And if you look at all the medical data, you'll probably lose, and you've told them the truth. So, it's very, it's a very sensitive thing. And so the people that are going to benefit the most are the people that are going to have a tendency to take responsibility themselves.
Okay. But it's very interesting, the one thing that I got out of that was high cholesterol is indicating that something else needs to be addressed. It's not the cholesterol that needs to be addressed. It's other things in the health history there.
Yes. So if you look at it, where they are right, they say cholesterol is an indicator of prediabetes or insulin resistance or obesity. Absolutely. Why? Not because you've got too much cholesterol, because that cholesterol is going there to try and quell the inflammation.
Yes, of course.
So the crux of it is, it's sugar that is causing this. Sugar is causing the inflammation. Okay, sugar causes our triglycerides to rise. Sugar will cause our insulin resistance. Sugar will cause our craving for carbs.
Yes.
So you've got to stop the sugar. And that's so difficult today because so much of our food is laced with sugar, the high fructose corn syrup, all of these things. And if you if I call you a consumer and not a healthy consumer, you just take anything off the shelf, all that processed food, you're being stimulated all the time. No wonder you're going to have all of these problems, right?
Exactly. And of course, when we're talking about taking back responsibility of your health, this does mean take responsibility of your diet, doesn't it? This is the first thing that everybody has got to learn. Thank you so much for coming in today, Anthony. It's been an absolute pleasure talking with you about all this. It's so important for everybody to be learning as much as they possibly can about how everything just ties in together, and what we need to be learning about.
Maybe I hope this little talk is going to help people to open a gateway to help them to see that, wow, it's not such a big monster in the room. I can slowly start taking responsibility for my health. And I say that slowly because baby steps, and then you get more confident. And wow, after 3 months or whatever the time frame is, I'm feeling so much better. Okay. Yeah. There's not so many ambulances at those accidents. Actually, there's no ambulances and there's no accidents type things.
Brilliant summary. Thank you so much. Lovely to talk to you. Speak to you soon.
Great, Mary. God bless you. Bye.
Thank you so much, Anthony, for going through all of this with us. It's so just important for us to understand what we can do, what we need to do it, the tools that we need to use. So I do hope you enjoyed this session with Anthony. Next week, I will be talking to you about a homeopathic life, about what it means to be a homeopath, how it just working with homeopathy kind of takes over your life, and how it incorporates many changes in all aspects of your life. So if you've got a few minutes next week, I look forward to having you join me and talk about homeopathy. Speak to you soon.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.